Anytime the pulp of a tooth has been injured or irritated, there's a possibility that it may become swollen and painful. This inflammation is called pulpitis, and it can happen for various reasons. Occasionally, placing a restoration close to the pulp can cause it to become inflamed. Other times, the pulp may become inflamed due to an injury. In both of these cases, the pulp may calm down on its own, but sometimes it can die or become infected. The pulp can also become infected when tooth decay allows bacteria into the pulp. Sometimes there is no apparent reason. You may realize you have pulpitis because the tooth is sensitive to hot, cold, or pressure, or there is throbbing, pain with biting, looseness, swelling, or a bad taste in your mouth. You may also be unaware of the problem because you have no symptoms at all. To select the best treatment, we'll perform a thorough examination, which may include taking x-rays or using a pulp tester to check the health of the pulp. We may also apply heat or cold, or tap lightly on the tooth to observe sensitivity, or press gently on the gums next to the tooth to check for pain. If the pulp is mildly inflamed, we may recommend treatments to ease any discomfort and help the tooth heal. If the pulp cannot heal itself or is infected, we'll recommend root canal therapy to save the tooth. Treating an inflamed or infected tooth will relieve discomfort and restore the health of your mouth. When the pulp of a tooth becomes infected or dies, root canal therapy is necessary to save the tooth. The pulp is a soft tissue made up of nerves and blood vessels. It's contained in the pulp chamber, which extends from the middle of the tooth down through the root canals. It becomes infected when bacteria invades the pulp. This happens most commonly through a deep cavity, which allows bacteria through the enamel and dentin layers and into the tooth. Sometimes the pulp simply dies due to a fracture or a blow to the tooth. You may realize you have an infected tooth because it's sensitive to hot or cold. The tooth hurts with biting or pressure, or there is throbbing, severe tooth pain, swelling, or a bad taste in your mouth. You may also be unaware of the problem because you have no symptoms at all. If left untreated, the infection can travel through the tips of the tooth roots and into the jawbone, where it can dissolve the bone and form a painful abscess. To determine if your tooth has an infected pulp, we'll do a thorough examination, which may include x-rays. The exam sometimes includes checking the health of the pulp with a pulp tester. We may also apply heat or cold, or tap lightly on the tooth to observe sensitivity. Look for changes in the tooth's color, or press gently on the gums next to the tooth to check for pain. If we determine that you have an infected tooth, we'll talk with you about treatment to remove the infection. Root canal therapy is a generally comfortable treatment that can save your tooth and keep your mouth healthy.